Hello, this is Dr. Gay from First Look MRI, and this is a 62-year-old female who injured her foot 2 weeks ago. She had continued pain and swelling and went to her orthopedic surgeon. They did an MRI scan. She has pain where markers have been placed. Let's see if we can find the markers right here in the dorsal soft tissues, right here the forefoot. And deep to that, she does have some edema in the soft tissues. We'll put up a view here where fluid will show up as bright edema. Here's some brightness over the dorsal surface. This is getting into the great toe there, second toe. You can see all this edema over the top of the foot going in towards the ankle. So soft tissue injury involving the soft tissues for sure. Now we're going to look at the bones and ligaments. And on this view, we call this a coronal view. We can see the great toe, second toe, metatarsal bone here. If we go back to this view, we'd see that this is a bone in the foot here, the back of the foot. This is called the talus. The front, the anterior process. This is the navicular bone. And we see that there's an abnormality in the front of the navicular bone. So there's a little fracture right here at the anterior navicular bone. If we put up another view in the same orientation, on this view, abnormalities, the marrow, instead of being dark like this, the marrow will be bright. So marrow is suppressed. Should be dark normally, but where we see brightness, that's abnormal. So we see this foggy area of brightness corresponding to this little impacted fracture in the front of the navicular bone. And we do see a little bit of edema right over here. This is the second metatarsal bone, some foggy edema over here. So we want to look at that area more closely. Maybe a mild contusion involving the medial cuneiform bone here. Maybe some here in the second cuneiform bone. So the main finding on this view is an impacted, minimally impacted fracture of the anterior navicular bone. Now we notice this edema right over here in the second metatarsal. There's something very important about this area. There's a ligament that goes right across here called the Lisfranc ligament. And so when we see edema here, we want to be very careful that there's not a tear of that ligament that bridges this medial cuneiform bone to the base of the second metatarsal bone. So we want to see a nice, well-defined black line here. But instead, we don't. We see a little dark area here. That's that ligament, the Lisfranc ligament. And we see a little area of brightness right here. So this is the attachment. And it is yanked off that bone, and it's hanging out here. There's the end of it there, so it's not attaching. So we have a ruptured Lisfranc ligaments. This is very serious because the Lisfranc ligament holds the second metatarsal base in position. When this is torn, this can drift laterally. You can get a midfoot dislocation. These bones here will drift out to the side. It can be a really devastating injury. Right now, there's no significant subluxation or dislocation of the midfoot, but this is a critical ligament, so you need to be able to recognize this for sure and know that this is a hot spot to look at. Now, when we put up another view, we're going to try to find this ligament injury on this short axis view. This is a short axis protein density fat suppressed sequence, and we're going to go right through where we think the ligament should be, and that little dark line is the ligament. So we can see it attaching to this bone, the medial cuneiform bone right there, one cut over. We see it here hanging out in the breeze between these two bones. And the next cut, we see it right here. Next cut, we don't see it at all, so we just don't see the attachment. We should see something coming off horizontally, touching this bone and this bone. So this is an example of a torn Lisfranc ligament. Very easy to jog past unless you're really looking carefully for it, and something critical to see because this has big implications about their well-being. The surgeon's going to have to go in there and reconstruct this ligament to give the midfoot stability. And also don't get happy eyes when you notice a fracture. It's easy in radiology, from my own experience, to see something and say, hey, I'm done, I see a fracture, that's the problem. And forget to keep on looking for something that is even more important like this. And that's it. Thank you so much.